Circumcision is a very common procedure that most men will have gotten early enough in their life that they can't even remember the procedure itself. But every now and then there's someone that comes into the office and then they want a circumcision. Maybe maybe someone told them that they should get a circumcision, or maybe their girlfriend would like them to get a circumcision. Maybe they've always wanted to get a circumcision and they never had one. Maybe they thought they would look better with the circumcision. There is a medical indication for a circumcision. It's called balanitis. Sometimes the foreskin of the penis gets inflamed, and when it gets inflamed, it gets narrowed. And when it gets narrowed, you cannot retract the foreskin enough to actually uncover the whole glans. And if you cannot retract the foreskin, then definitely you would be well served to get a circumcision for several reasons. First, you can't really clean the glands if it's completely covered by this foreskin. And if the foreskin is narrow at the tip and you can't retract the glands, you cannot also inspect it. If you cannot clean it, you cannot inspect it, you cannot rule out that you have penile cancer. Penile cancer is a lot less common in this part of the world than in other parts of the world, but you do need to retract the foreskin and inspect it regularly to make sure you don't have penile cancer, and in order to clean the inside of the glands. So I did see a patient who did not know that he should be able to retract the foreskin, and not all men know that. So that's the reason why I'm going over this, is because everyone should know that that retracting the foreskin is a medical necessity, and not being able to retract the foreskin all the way is a medical indication for getting a circumcision. And the foreskin gets tight at the tip and you're not able to retract it. There could be a couple of different reasons. The first one, most commonly it happens actually with diabetes, because the foreskin, if you think about it, it's really at the tip of the penis, and there's really nothing there's no muscle underneath it. So it's basically, it's a flap of skin that's going around. And when if someone has diabetes, the vascular supply to the tip of the foreskin is not very good, because diabetes hurts the small blood vessels. It's a microvascular disease. So microvascular means like tiny blood vessels, and diabetes is known to have a microvascular disease effect. And that's why, for example, it affects the tip of the fingers, it can affect the nerves, and that's why diabetics are always instructed to always inspect the sole of their feet, because a lot of times they lose sensations to the sole, and they can have an injury to the sole of the feet and they won't even know it. So that's why they need to always inspect, i.e. visually look, to make sure that the sole of the feet are intact and they're not affected. Same thing for the penis foreskin. They need to make sure that you can always retract the foreskin. The procedure itself takes about half an hour. It's very simple. It's not very complicated. It's not very dangerous. All we have to do is cut the foreskin off and then reattach the foreskin from the glands just beyond the corona to the rest of the foreskin. And there is a recovery period of a week or so before everything is healed up and it doesn't hurt. But by and large, the pain is minimal, certainly not enough to keep you away from getting a circumcision if you need one. So make sure you can always retract your foreskin. If you want a circumcision for cosmetic reasons or for medical reasons, this is something that you should know about.